Hello, good evening, good afternoon, good morning, wherever you are from. Greetings from EduSkills. Please type in where are you from at YouTube. Those who are joining at YouTube. Good evening, everyone. We are starting in 2 minutes as soon as people get in.
But
Good
the
evening.
recording is not on.
Thank you. Good evening, everyone. Please type in where are you from. Please mute those who are in the Zoom classroom. Yes. Good evening, good afternoon, good morning. If you have some concerns, you can type in. We'll begin soon. At the chat box, YouTube comment space. Let's have a minute silent prayer. Okay, welcome again to EduSkills OET Made Easy. Our mission is to make you fall in love with OET. If you are watching this on YouTube, kindly consider subscribing to the channel. Give us a thumbs up if you like our work. And please share to your contacts so that we reach out to maximum number of OET aspirants, especially those who are financially struggling to crack OET. Today, we are going to deal with the reading part A, and I'll be dealing with fifth sample from the official OET website. Thank you, OET, for allowing me to use this for teaching purpose. And the title of the sample is cellulitis. And majorly, we have done a lot of things, a lot of sessions on part A. Today, we'll be more of looking into how we can analyze the whole thing. So let me share my screen. Let me know if you can see my screen. Yes, at YouTube, please comment if you can see my screen. Yeah, there are so many people at here. Many of you will have doubt why we are not admitted to Zoom classroom. Zoom classroom is mainly for the active learners. However, if you are active, definitely you can be here at the Zoom. Okay. Good. So, sample 5, reading part A, cellulitis. As you know, we will just have a glance if there are beginners. Are there some beginners? Please type in if you are a beginner. Let me know. Further, I'm a beginner. How can I pursue? How can I start? Yes, okay. Yes, so we'll be having 2 minutes for the beginners just to glance through how to start with. Yeah, 5 principles or panchatatvas of skimming. Skimming means reading fast. That's all simple you have to understand for now. Reading fast. I'll show you practically how it is to be done. Am I audible and visible at YouTube? Please type in yes or no. Are you with me?
Yes.
Please type in at YouTube. Am I audible and visible? Sunaina Arora, I am going to answer you. Your concern? Yes, beginner, yes, yeah. Yes, further audible and visible. Yeah. So how do you skim? Skimming means, in simple terms, just reading fast, just looking at the clues or I think that we notice. Not all the things, but main things. I'll tell you what are things you have to notice. Skim for main heading. Now, you know, cellulitis is the heading. So you just associate what is cellulitis, you know, itis and all those cities. Medical professionals, you know, the details of each condition. Second one, focus on the subtopic of each paragraph. Each paragraph will have a heading. That is also known as subheading. If you don't have, you can read the first line. Definitely, you know, the theme will be there. So focus on it. Third one, keywords, phrases of each paragraph. Find out what are the keywords in the each paragraph. I'll let you know what are they. We'll go through it. And fourth one, stem words or keywords of the question statement. Once you glance through, skim through the text, we'll go into the questions and find out the keywords or stem words. Then synonyms, synonymous language, paraphrasing in the text. We'll compare the text and the question statement, keeping in mind that we may not have the same words and expressions given in the question statement as it is given in the text. So, okay. So reading part A in 10 minutes easily, it can be done in 10 minutes, maximum 12 minutes. And IDM has taught you so many times how can be done even live. It was demonstrated. So tip number one, begin with a skim. Skim means fast reading. And, you know, tip number two, focus of each text. You know, as of now, cellulitis is the title. Focus is first text speaks about definition and etiology. Etiology means, you know, it will speak about the causes, right? What are the causes? Then severity. In other words, any other word could you type in the comment space? Any other word for severity? Or drug therapy. Give me another word for drug therapy. Medication. Then management of affected area. So we can say definition, then severity means could be something like complications, then medication, then management of affected area. So focus on these each text. You will get, especially the first 7 or 8 questions, you can just dash through because there will be synonyms of these side headings, text headings. Tip 3, skim and search for these clues. What are the clues? Names of some condition, some organs, some medicine, anything of that sort. Names, any names, just highlight those names or focus on that. Then number, percentage or measurements or dosage, you can say in medication. Dosages are important. Number means also dosage. Then sequential expression. Sequential means there will be some sequence, first, second, third, or that way there will be some sequence in the reading. You can even focus on that. Time expressions probably will be there. Then scale expressions, which I'll explain later, and adjectives and negative expressions. These are the major things you'll have to just look into. And in most of the part A, you will have to look into the names of conditions, disease, medication, or organs, or instruments, or what you call different medicines. Also number the dosages and other things in the medication part of it. So text headings, subtopic of each para. Text headings here you have. The main heading is cellulitis. Text heading is definition and etiology, severity of cellulitis, suitable drug therapy for typical cellulitis, and management of the local affected area. So what you can do, just write down on the when you practice, just write down on the paper. Definition, in short, you can write definition and etiology, then severity, then therapy, drug therapy or therapy, then management. Simple one words, whatever you understand, just for your purpose of understanding, write 4 words. That will be cool. Okay. So part A, normally for the beginners, I'm telling you 4 texts, A, B, C, and D. All these 4 texts will have one theme. So there's a connection between these 4 texts. Yes, I have shown here. The whole thing speaks about cellulitis and its definition, etiology, severity, therapy, and management. Then 20 questions, 15 minutes, and we suggest you practice and defeat the time maximum 12 minutes. Or we recommend do it in 10 minutes. There are many people who have done in 7 or 8 or 9 minutes. That is no issue. Greatest challenge is time. Try to defeat time. That's by smart work, not by hard work. Smart work, not the quantity of practice materials, but quality of practice is important. That's what we are teaching now. Then, it's expeditious or fast reading task. Here you should not get stuck into anything. You should not be searching everywhere for the answer. Just if you don't find some answers, simply skip and go. You can revisit again. So, no, it's fast reading. No digging deep into the text. Text heading, subtopic of each paragraph. So this is what I said. So when you look here, what do you understand from the heading? It speaks about definition and etiology, means cause. And you can know, maybe I'll just have a glance at it. What do you have? Maybe here you have definition. Okay. Here you have definition. See, this is definition. Then you have the commonest, that cause, cellulitis, means that's about, you can type in the comment space. Yeah, these are the causes. The next, after first paragraph or the first few lines, two sentences, it speaks about causes, Then the whole thing repeated again, cause here, cause, and cause. Then you have cause. So you can simply see the same word repeated time and again, which says this speaks about cause. So what could be the answer? A cause could be the answer. So that's how you have to glance through. Just understand, you do not look into every word, but you can just go through and glance through it and find out. And coming to second text. Okay, this one I'll just put on. Yeah. So here you have. Sorry, I'll just make it clear. Yeah. So now this is severity of cellulitis. Severity, what you understand by severity. Ultimately, this speaks about some complications. Then severity means intensity, class 1, class 2, class 3, class 4. So when you skim, what you have to look into? These classes. Okay, in the question, they will give you a class. Immediately, if they're asking about class 3, you have to dash into that column. Immediately, you'll find the answer there. Okay, that's how you skim through the text. And again, you have text 3, suitable drug therapy. Immediately, it is about medication, right? You can, in the Zoom, you can respond, okay, no issues. Therapy. So here you have to see, they are speaking about drug therapy. What will be the answer? Normally, you have to look into when the class is given, subheadings are given, you have to focus on the class. Then medicines. That speaks about medicines, dosages. The questions will be definitely on medicines and dosages. So immediately, you have easy, what you call track lines here, class 1, class 2, class 3, class 4. So you can just jump into that. We'll go into the questions, then we'll understand. Third one is management of the local affected area. How do you manage? How do you manage? So whatever comes in connection with managing the cellulitis or the affected area, answer will be in D segment. So let's check how to go about the first one. Now come on, answer. Now here you see, you should know, first one is definition. Etiology, what you have to write here is only the word, right? The spelling. So here, what is the synonym you find about these words? Maybe I will just put it in another column, short forms. Severity, you can take it as complication or intensity. Treatment, I have made it in another synonym is treatment. Management. Okay. Now tell me, here, do you have a word similar to anything?
For
First
the
one.
cost.
Caused by less treatment for cellulitis caused by less common bacteria. Okay, caused is there. Then otherwise, etiology is there. Treatment is there. Okay, there are two things now: treatment and etiology. Let's check. Then the second one, reason for drawing around the area affected by cellulitis. So important word is reason, right? Yeah, because reason for drawing around the area affected by cellulitis. Third one, where and how to best to treat. Treat. Yes. Then here again, symptoms. Okay.
Equipment.
Equipment for ensuring that patients' legs are more comfortable in bed. Equipment.
Management.
Yes. Next one, alternative medication for cellular patients who cannot. One type of antibiotics.
Medication.
Alternative medication. Okay. Let's check. Don't worry. Seventh one. 7. How to deal with the infection site after the swelling has begun to reduce.
Infection site.
Yeah, when infection happens after treatment or before treatment?
After treatment. Management.
Management. Okay. Let's check. We will not confirm now. Then who should be consulted regarding pharmacotherapy for cellulitis?
Who?
Consulted. Who should consult?
Consultation comes under which heading? Please mute. Those who have background distractions at the Zoom classroom, please don't interact, okay? Others can interact. If you have some background distraction, please don't unmute your audio. So treatment, let's check. We'll check what it is. So what is treatment is C, right? As you said, treatment highlighted, it should be C here. I'm not confirming it. Let's check. Second one, reason for drawing around the area affected by cellulitis.
Cause.
Drawing around the area affected by cellulitis. Why do you draw? When do you draw around the area?
Some abnormal when we notify.
If any swelling is increased or
so when it happens before the treatment or after treatment?
After the treatment also, maybe we can tell the patient if there is any changes.
Yeah, let's check. We have put D there. After the treatment means it will be management, right? Let's check. No problem. Then 3.
Again, C.
A system for determining where and how best to treat patients with where and how best to treat patients with cellulitis. Treatment is based on, for example, you have a severe accident. Will you take the patient to the PHC? Maybe for first aid you will take, but for the treatment?
Shift to the hospital.
Yeah, you take probably, if possible, you will reach a medical college, right? A good high specialty hospital. So here they are asking where and how best to treat. Depends on what?
Severity.
Yeah, severity, exactly. Yeah. So it will be severity is B. Okay.
B.
Sorry, I'll put B here instead of 1, 2, 3. So course you can understand. Fourth one is symptoms that may be experienced before the infection is visible. Before the infection is visible.
A, father.
Yeah. Fourth one, A. Okay.
A, father.
Definition and okay. Symptoms. A. Then equipment for ensuring the patient's legs are more comfortable in bed.
D, father.
Syntax D,
Management. Okay. So you know these things without even reading. Okay. We haven't gone to the text to refer. Alternative medication for celiac patients who cannot tolerate one type of antibiotics.
C. Drug therapy.
Therapy. C.
C.
Medication is there, right? Medication. So it must be C.
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 Okay. Then how to deal with the infection site after the swelling has begun to reduce?
Management.
Management, yes. D, yes. Correct. Management, yeah. Then who should? See, how to deal. How to deal itself is a synonymous expression of management. Who should be consulted regarding pharmacotherapy for cellulitis?
C.
Yeah.
C.
C. Yes. C, yeah. Ultimately, these are the things. Let's check. I have the key here. Let me check whether we are right. So we'll check. Okay, I'm reading from the key here. C, number 1 is C, number 2 is D, number 3 B, number 4 A, number 5 D, number 6 C, number 7 D, number 8 C. Are they all right?
Yes, Father.
Yeah, that's it. So simple as that. Definitely, you can do this and run fast and complete and come back because you have 15 minutes, right? This can be done within fraction of seconds. As you read through, you will mark. Now, as I'm teaching, it takes more time. Otherwise, you can just mark and go. Maybe you can confirm when you revisit back if you complete it in 7 minutes or 10 minutes. Then you have 5 more minutes to check with the. Definitely, you have to confirm it with the text. Okay. Let's see now the same way. Now coming here, which antibiotic formulation is not suitable for treatment of cellulitis?
C.
Hmm?
Father.
Treatment.
C.
Treatment. C. Okay. Let's check. We'll check then. Then, which pre-existing weight-related condition would prompt a class 2 categorization?
Categorization.
Categorization. Where is it said categorization?
B.
Categorization.
B,
See,
Father.
this is the. That's why I said you have to read the subtopic as a
B, Father.
categorization. Categorization synonym here is classification. Okay. So definitely, it is in B. Okay. So that's why you have to keep those things in mind. You can write down. So this one is categorization is
Class 2.
B, right?
Yeah.
Yes. What single dose of
C.
dose
Father.
now? Dosage comes where? Dose of name is there. Yeah.
Medication.
Ultimately, dose is medication. So immediately you know where to go. So C. Okay. Then class 2, you have to highlight those things also. Okay. Class 2 will immediately tell you inside that particular text where to look for. Okay. Then what may be impaired if anti-inflammatories are given to patients who take ACE inhibitors?
C, Father.
What may again?
C.
C. Okay.
C.
What you have to highlight here? Anti-inflammatories. Inflammatories are given to patients who take ACE. This is known as name or abbreviation. Okay. Rush into that particular abbreviation. In the text, go to that abbreviation. We'll go to it now. What is the single dose of oral fluoxetine? Sorry, how do you say that?
Dose. Medication.
Okay. Yeah, dose of oral. Yes.
C. Father.
Now, yeah. Dose is again C.
Drug therapy.
Drug therapy. Yes. C. Yes. Then
Yes.
coming
12
back
to
to what is the maximum single dose?
C. C, Father. Treatment.
Now again C.
Right.
That's what I'm saying. Immediately you go there. Now let's check. Now first one is C, right? Now you have 4 C's here. Let's check whether they are right. Where is
Father,
C
12
in text?
But
Pardon?
12 is Father
12 is D. Father.
D.
12.
Is D.
D.
What may be impaired in
Impaired.
B is severity, right? Impairment.
Yeah.
Okay, impairment. Yes, you are right. Impairment. That is, yeah, impaired. Yes. So let's check with the this one answers. First, we'll check and come back. Where is it? C, right? First one is C. Yes, text C. Yeah, here is the text C. So we go to class. Okay, what is the class? Sorry. This one.
Class 4.
Yeah. See what single dose.
Hmm.
And class is given class 4. So what you have to do?
4.
Go to class 4 immediately.
Class 4 call.
Then what you have to do? You go to class 4, then you look for this name. Name of the medicine.
Medicine.
Yeah, name of the medicine. You have the name of the medicine here.
Mhm.
So what single dose of? Dose is given here, 2.4 G grams,
G gram.
right? Is that clear? So those are the things you need to just look into the class, side heading, subheading, then go to that particular name. Normally it's a name or a dosage or whatever. So it is either number or name. Cool. Other one is, next one is C. That was 12, right? Single dose of this one, single dose. And class is not given here, but then what is the single dose of oral flux? How do you say that?
Flucloxacillin.
Okay, sorry, I am not very familiar with that name. Okay, so the name is there, right? So what you have to go? Immediately you have to go to the name.
Flucloxacillin.
Name in the text. Where do you have the name in the text?
Class 1.
In the class 1.
Class 1.
So what is the single dose of oral? So you have here, yeah, 500. Name is that it is clearly given how many, what is the dose? Okay, single dose, 4 into per day. That is clear? Then, yes, then next one is 13. Single dose of, sorry, that was done, right? Fourth one, 14. What is the maximum single dose? Clindamycin. Okay. Clindamycin is this one, okay? This is wrong.
Cellulitis.
Class 4.
Cellulitis.
This is not the one. Oh, take it away. That's a mistake. Yeah. Here, right?
Yes, Father.
Yes, it's given here. And you have the clue here. What is the clue?
Maximum
Clue?
single
Maximum.
Class 4.
Maximum.
No, class 4. Maximum is there.
Class
Even
4.
otherwise, easiest clue is subheading.
Class
Yes,
4.
Subheading. Class 4, immediately you know where to go. And you have name of your medicine. You have only 3 names here. You have to just see which name and what is the dosage. Okay. Hope that is clear.
Yes, Father.
Okay, now we are in question number. Where do we reach? 14, right? Yes. Now 15. Let's see all these. Keep in mind, always see that every page you write down these headings. Okay, maybe short, you don't write all the things. You can write definition and etiology, severity, therapy, or treatment management. That's it. So it may be necessary to carry out dash blisters caused by cellulitis. Any clue?
Affected area.
Carry
Which one? A, B, C, D?
D, Father, under management.
It may be necessary to carry out management. D. Okay. That is how you have to understand from the meaning of the sentence. When, what is that? Prescribing anti-inflammatories, that may be used as an alternative to ibuprofen.
And the
Where A, B, C, D? A, B, C, D?
D, Father, manage.
When
Affected
prescribing
area.
Management.
anti-inflammatories, management, right? If there is only infection. Let's check. We will not confirm. A patient may have been exposed to infection by swimming in surface water or dash using. Sorry, there is a mistake. Using dash, okay, or using after that. Yeah, it must be.
A, etiology.
Yeah, etiology. Yes, definitely. You know, swimming, using something. All those are yeah. So next, conditions such as dash or even metastatic cancer may be mistaken for cellulitis.
Etiology. Definition.
Severity.
Severity under
Conditions
D.
such as Let's check. We'll write. C, you said? No. B, you
B.
said, right?
B.
B.
It's
Okay.
B.
Patients with accelerating. What is this? I can't see it. Sorry. Fix errors. Yeah, cellulitis. Sorry, I couldn't read it. Patients with exacerbating cellulitis, a compromised immune system, and those with DASH should be hospitalized. Where do you think of hospitalization
Severity.
before
Again,
treatment?
B.
Before
B for
treatment or
B, Father.
B. It's severity.
B?
B.
Okay. Yeah. Again, the same meaning as I said earlier, no? You had one B in A part. When you have intensive, great accident or severe injuries, you take to better hospital. Hospitalization will be discussed there. Patients suffering from DASH can experience repeat episodes of cellulitis. Repeat episodes of cellulitis. Definition, etiology. A patient suffering from DASH comes under what?
Yeah.
Some
Text
other.
A under the
Yeah.
definition.
Let's check now. Yeah, let's check now. Okay. Cool. Now, see, this is another strategy they use. The tick they use here. You see, here somewhere you have maybe or, and those things will be definitely answers. You have many here. One is or, where is it? The blisters caused by, then see, when prescribed anti-inflammatories may be used. Two things together. Using or, where is it? Using this one. You see, swimming or using something. Swimming and using something. So two things, and or conjunction. That's called conjunction based question, whether you understand the meaning of conjunction. So where we have to go? D, right?
Yes.
Yes. Now let's check. Okay, 17th one is in A. Let's check. See here, etiology. The patient may have been exposed to infection by swimming in surface water or using of hot tubs. Using hot tubs. Since it is using, gerund is here, you need to write only using of hot tubs. You don't say using hot tubs, right? Yes, using hot tubs. Yeah. Then coming to 20th one in text A again, let's finish it and go. Patient suffering from DASH can, see here, recurrent cellulitis is more common in people who have means suffering from. Patients suffering from, synonym is people who have. Do you get it?
Yes, Father.
Patient suffering.
Yes, Father.
Yeah, patient suffering means pressure. And recurrent, repeat. Recurrent here, repeat.
Yes.
Recurrent, repeat
Yes,
episodes of cellulitis, recurrent cellulitis. Recurrent cellulitis means repeat episodes of cellulitis. So, patient suffering from DASH means, suffering from a condition, right? It should be a name of a condition. Patient suffering from DASH means it should be something, some sort of condition. So, you have here the answer. Okay. Let's check. Now B. Now 18th one you have in B. Now what you have to do? Conditions such as. Conditions such as means it must be the name of a condition. Or even metastatic cancer. Or even, that's what I said, conjunction. They use conjunction in different forms. Or even metastatic cancer may be mistaken for cellulitis. Note that many other common conditions, including DVT, share the same symptoms as cellulitis. Same symptoms means can be mistaken for cellulitis. Same symptoms means you can have confusions. It can be mistaken. The same is also true for rare serious conditions such as metastatic cancer. So if you have identified the names of the conditions when you scanned, these are two are names of conditions. And this question is based on particular conditions. Yeah, these two names are given here. One is here, metastatic cancer, and the other one is conditions such as or even. So DVT is the answer. So conjunction, how do they use the conjunction? In the text, it is given in two sentences, two aspects, but they have summarized, paraphrased into one sentence in the question statement. Is that clear?
Yes, Father.
Yeah. Now text B again. You have
Father.
19th question from text B. Okay. So now patients with exacerbated cellulitis, a compromised immune system, and those with dash should be. Now you see, as I told you, you can even ignore these things, what comes in between commas. You need not even read those things. Without that, you can find the meaning. Patients with exacerbated cellulitis and those with dash should be hospitalized. Okay.
Facial cellulitis.
Yeah. In addition, anyone who is immunocompromised, compromised immune system, immunocompromised, here it is given. If you need clarity, you can go into that compromised immune system, immunocompromised. Yes. As patients with cellulitis, and those with dash should be hospitalized. Has, in addition, anyone who is immunocompromised has facial cellulitis, is very younger or elderly frail, or whose cellulitis rapidly deteriorates, must be hospitalized. Should be hospitalized, must be hospitalized. Is that clear? Answer is?
Father.
Answer is facial cellulitis. Yeah, it's a direct thing. Yeah. Next one. Yeah, that's over. Then we have that you have seen 10th one. 10th one you see, this is the 10th one. Class 2. Which pre-existing weight-related condition would prompt a class 2 categorization? Immediately, you know, categorization is in? Categorization is in? Text B. Text B. So, severity with severity, you can also write classifications. Okay, such expressions, subheadings, main word you can use in bracket or dash, severity dash classification. So, you have class 2. Class 2, which pre-existing weight-related condition? Weight-related condition. Morbid obesity. Obesity means weight. Okay, that's why I said you should have a diary of synonyms. Diary of synonyms, where you have obesity and overweight, all those expressions, synonyms are written and practiced. Okay, so it automatically you can go in there. And coming here in 3:11, what single dose of medicine should be administered to a class 4 patients? Again, you have class 4 here. That's a clue where you have to look into immediately. So that's why I said when you scan, go through these subheadings. Class 4, you know, then you have the name of a medicine. Okay, name of a medicine. So you have to look for that medicine. That's all. Within class 4, look for that medicine. You know, this was also an answer, right? Earlier.
Yes, Father. Clindamycin.
Yeah. So you have, see, class 4 is mentioned. 3 things are given. 2 things are the answers. So cool it is. Immediately you can get into. Where are we? Yes. Now, again, the same strategy, you see. Name of the medicine is given. What is a single dose of oral? Immediately, you know, it is single dose means text C. Dose means text C, recommended for the least serious category of cellulitis. See, first line, least serious means first line, right?
Yes,
Hello?
Father. Yes, Father.
Yeah.
Yes, Father.
Yeah. So, least first line and second line. First line is what is the single dose? You see, 500 mg. For medical professionals, this will be simple as that, you know. How many answers from part C, text C, you see? Directly, you can go there. This is what I said. You have this as the answer here. What is the maximum? Again, you have class 4, name of the medicine. Name of the medicine.
Medicine.
Yes. Yeah. Text D, what may be impaired if anti-inflammatories are given to patients who take AC inhibitors? I said you should go look into this abbreviations. When there are abbreviations, you have to look into the abbreviations. Yeah. So that will help you to immediately allocate the answer in the text. You from the keywords, you locate the text, and from the names, abbreviations, or dosage numbers, you locate where exactly the answer lies. So what may be impaired if anti-inflammatories are given into a patients who take AC inhibitors? Take account of drug interactions. Anti-inflammatories are given to patients who take AC inhibitors. So interactions is a clue there. For example, co-prescribing anti-inflammatories with AC inhibitors or angiotensin receptor blockers may
Receptor.
pose particular risk to renal function. What may be impaired? What may be impaired? Renal function. Direct answer, right?
Yes, Father.
Yes. And you have 16th one here. When prescribing anti-inflammatory, dash may be used as an alternative to ibuprofen. If initiating an anti-inflammatory, it's obligatory to use ibuprofen or
Naproxen.
I said,
Yeah,
yeah. So I said,
Naproxen.
this is how they trick you with the conjunctions, use of conjunctions. So what is the answer?
Naproxen, Father.
Naproxen.
Yeah. You see, that's why I said 2-3 questions will be there based on the conjunctions. How do you use it? Which antibiotic formulation is not suitable for treatment of cellulitis? Avoid. Avoid means not suitable. The use of topical.
Tropical.
Yes, topical. Yes, topical antibiotics as there are unsuitable for the management. It's not suitable. Unsuitable. Not suitable. Unsuitable means you have to avoid, right? Whatever is not
Yes.
suitable should be avoided. So answer is topical antibiotics. Which antibiotic? Topical antibiotics, as these are unsuitable, not suitable. Unsuitable, not suitable for the management, for treatment of cellulitis. For management of any class of cellulitis. Means for treatment of any cellulitis. So topical antibiotics are not to be used. It's not suitable for treatment of cellulitis. Is that clear?
Yes, Father.
Yes, Father.
Yeah. That's as simple as that, but you need to have patience and practice gradually. You need to visit any of these slides, any questions. If you don't understand, we can revisit. Since majority are not beginners, so we have gone a little faster. What you have to do, you have to write down in your notebook this sentence and as well as this question statement along with the answer. When you practice, you have to write down the text as well as the corresponding question statement. That's how you get the idea of paraphrasing. How do they paraphrase questions? And they are all almost same. There are no different types. A certain category of paraphrases are used. For example, conjunction. Do you understand use of conjunctions? And those are the strategies. When you write down these things repeatedly, you will get it in your brain. All this, you have to write down this one, this text, class 2, this text as well as this question statement. Every question statement you have to write down. This is not only for this part A. This is also going to be useful for B, C, as well as listening A, B, C. Paraphrasing is very, very important. That's where you have to gain competency. That happens by writing down and making a diary of paraphrasing. So if you are, I think you know that I have been telling you about the diary of synonyms, diary of synonymous language, diary of paraphrasing, diary of scales, diary of what else? Yeah, absolutes, all those things, different diaries. I have mentioned and elaborated on that. Any clarification on any answers? It's clear, right?
Yes, Father.
Yeah, then you can get back to discussions if you have anything in general. Yes. Even at YouTube, if you have some concerns, you can. Yeah, thank you so much, Father. God bless you. And you're welcome, Ruxana. Yes. If you have any concerns at YouTube, you can just type in the comment space. Or else you just want to join Zoom, admin, somebody can just paste here. Some of them, if they want to just come and discuss here. Can somebody paste the link? Are you able to paste or should I? Let me check. Yes. Can somebody post the Zoom link in the admin panel? Admins? Just post the Zoom link in admin panel. Yeah, it's here. I got it. Yes. I can post it here. Yes. I have posted under FATA. There is a Zoom link with the name FATA. If somebody wants to join for a discussion at the Zoom, you can join. Click that link and join. I have repeatedly posted 3 times. Yes. Any concerns at YouTube? Admins, please let me know if they're asking something. Yeah. Yes. Yes. Any concerns at the YouTube comment space? You can just post it. If not, we will stop YouTube session. If you want to join the Zoom classroom and discuss something, you are welcome to join. The link is posted there. Zoom classroom link is posted. Yes, Malik, you can click on that link and join now if need be. So we are winding up YouTube session, okay? Bye, everybody. Yeah, I really appreciate your clear response. Thank you. You're welcome. Yes. Okay, if somebody wants to join, you can click on that link and join here for Zoom 5 or 10 minutes if you have some concerns to discuss about. So at YouTube, bye, everyone. We'll get back to you. Okay, cool. God bless you. You can respond and come to the main platform. Maybe I'll post the main platform link if you don't know. Somebody please at admin panel, you have, I think it is there at the main platform. Yeah, OET EduSkills. Okay. Yeah, at YouTube, if you need the main platform link, if you are a big new person here, you can just take this link which I am posting now. I posted repeatedly under name FATA. That's the main platform link. You can click that and join. Yes. That's cool. Bye, everyone. God bless you all. Yes. YouTube live ends here. And Joanna, now you can ask Arya ma'am.